Well, I had been noticing a shadow over my left eye, but it would go away.
I got shot in the right eye with a BB gun.
So I just went to the doctor and told him of this problem that I have with, strings in my eyes.
Unfortunately, I think you do have a detached retina, and that can explain your symptoms.
A detached retina can threaten the sight of one of your eyes, but in most cases, it can be treated. To understand what a detached retina is, let's look at how a healthy eye looks and works. Most simply, the eye is like a camera. To see, light enters the eye through the lens and cornea and is focused on the rear wall called the retina. In between the retina and lens is a large space filled with a thick jelly-like substance called the vitreous. The retina is made up of millions of light-sensitive visual cells that send images along the optic nerve to the brain. The critical central portion of the retina is called the macula. The macula is responsible for our straight-ahead vision, which we use for most of our everyday activities, such as driving, reading, or sewing. A detached retina begins with a tear or hole that forms in the retina. There are several types of retinal detachment. The most common is rhegmatogenous, or tear-related. Liquid from the vitreous body seeps through the tear, pushing the retina away from the back of the eye where it gets its nourishment. As the detached retina spreads further toward the center of the eye, it progressively blocks vision, as if it were a shadow or curtain moving from the outside part of your vision towards the center. If the retina is totally detached, vision is lost completely. Several conditions can lead to retinal detachment. High myopia, or nearsightedness. A condition called lattice degeneration. A personal history of retinal tears, holes, or detachments. Or a family history of retinal detachment. Retinal detachment is more common in eyes which have had previous surgery, even if that surgery had no complications, or as the result of a direct blow to the eye.
Then there's nothing I could have done about it.
Not really. There are certain conditions that make this more common, but in your case, I think it's more or less just bad luck.
A detached retina can happen at any time in your life, but it's a common condition in middle-aged people. As we get older, the vitreous gel liquefies and is more likely to separate from the retina. This makes the eye more susceptible to possible retinal problems.
If you only had a tear in the retina, it might be possible to fix it with simple laser treatment or perhaps just freezing treatment. But in this case, fluid has begun to seep through the tear, and there's retinal detachment around the tear, and a full operation will be required to repair the retinal detachment.
Depending on the type and location of the detachment, your doctor may recommend surgery within a day or two. In some cases, surgery can be delayed for a few weeks.
Well, suppose I don't have surgery or put it off a little.
If you're lucky in putting it off a few days, there might not be any harm. But over a few weeks or a few months, and certainly over 6 months or so, the natural history is for the entire retina to detach and all of the vision to be eventually lost. In most cases, we can physically reattach the retina and repair the retinal detachment, and normal vision may return. However, if the central vision or the reading vision has already been affected before the surgery, some degree of permanent visual loss or permanent impairment is very common.
Surgery to correct a detached retina has become a common procedure and is successful in reattaching the retina in about 90% of the cases.
Good morning.
Good morning.
My name is O'Connor.
You will most likely be admitted to the hospital or surgical center the day of your surgery. Some patients may be admitted a day before the procedure.
Thomas B.
In some cases, you may be asked to lie in bed for a period of time before surgery to help the retina settle and to prevent further detachment.
Are you allergic to any medications?
No, I am not.
Before your surgery, one or more members of the hospital staff or surgical team will take a medical history and answer any questions you may have about your operation. Also, in some cases, your doctor may want to patch one or both eyes to help relax the muscles and reduce eye movement. You will have either local or general anesthesia, depending on your specific case. The surgery usually lasts between 1 to 2 hours. Surgery to repair a detached retina has 3 steps. Step 1 involves examining the eye for the exact location of the tears or holes. There may be more than one. In Step 2, your doctor creates a mild inflammation in the area of the tear or hole so that your body's natural healing processes can be activated to close the tear. The 3rd step helps reposition the retina to the back of the eye. There are 2 ways this procedure is done. In the external method, a silicone sponge or balloon implant pushes the wall of the eye toward that part of the retina which is slumped into the vitreous body. After a period of time, a scar forms between the retina and the back of the eye. This scar holds the retina to the back of the eye. In the internal process, an air bubble is injected into the vitreous body. This bubble will naturally rise to its highest point. The patient has to be positioned so that the retinal tear is above the rest of the eye. The bubble then pushes the retina back into position with the same hoped-for results. Which technique your doctor will use depends on many factors, including the location of the tear and your general state of health. One of the most important factors that determines how much vision is restored is the vision you had going into the operation. In general, patients with good vision before surgery have a better chance of still having good vision after surgery. Patients with poor vision before surgery may show some improvements, but remember that without surgery, it's almost certain that you'll slowly lose sight. As with all operations, retinal surgery has certain risks. These include the effects of anesthesia, bleeding, infection. Also, there's a risk that the tear or hole in the retina may not close up, or that the retina may not reattach. Another risk is that the retina may tear or detach again. This is the most common cause of surgical failure. How well the retina stays reattached depends mostly on your own body's healing process. If abnormal scar tissue forms, it can lead to new tears and redetachment at a later date. It's important to remember that over 90% of retinal detachment surgeries successfully reattach the retina without these complications.
Good morning, Mr. O'Connor.
Oh, good morning, doctor.
How are you feeling this morning?
Well, feeling pretty good.
Recovery from retinal surgery is relatively brief. You may wear an eye patch for a week or 2 or somewhat longer. However, when surgery has included the air bubble technique, you may be restricted to a reclining position lying at a certain angle. This may be required for a few days to improve the chances of success.
Hello. Oh, hi, Michael. The doctor said everything went fine. No pain.
You may feel some discomfort around your eye for several days after surgery. In most cases, you can resume quiet activities within a day or so. However, in other cases, your doctor may limit your activities for a period of time. During follow-up visits in the weeks after surgery, the doctor will look to see how well the retina is healing.
I'm very pleased. The retina is reattached. It's back in its normal position. Now, it will take a few months before we can be confident that it's going to remain reattached and before we can determine how much vision may return.
Pay attention to your vision during this time. If you notice any progressive loss of vision, increased pain, increased redness, or increased discharge, call the doctor. These could be warning signs of a new detachment or of an infection or other problem. A detached retina is a serious eye problem that demands prompt treatment. And surgery is currently the best method to prevent further complications, including the total loss of vision.